Okay, well, welcome. We have a very interesting station here to demonstrate to you. It's called MyView by Diversitech, and we have Dr. Katie Blevins, our foregut and bariatric surgeon, who will review the technology. What is MyView, Dr. Blevins?
So we're really excited because we are just getting this at our institution, but this is a mucosal integrity testing. So what this device is it's this array that can measure basically the impedance on the inside of the esophagus. And so it's kind of an add-on of what we can do. So what we actually do is you do your scope, see what the normal anatomy looks like, and then after that you can add this cap to the bottom, and it's got some electrodes on the end. You just kind of slide it down. And then you want to just push this hard up against the surface of the esophagus. And you know exactly where the GE junction is because you've already done your endoscope. And then using this interface, we can basically measure the impedance or the mucosal integrity of the esophagus. Now, why do we care about that? Well, based on the data that the company has done, we see we can get a really quick, easy access to be able to look at what the impedance is. And what's interesting is normal esophagus has a certain pattern of what looks normal on impedance. Something like GERD has a pattern of what we expect it to look like on the inside of the esophagus. And then other kind of weirder ones that are harder to differentiate, like eosinophilic esophagitis or EOE, that has a very specific pattern of this. And so this really helps when maybe you have inconclusive Bravo testing or pH testing, or maybe a little bit of difference between, you don't know exactly what's going on. And so this is really cool because at the same time of the initial endoscopy, if you're worried about it, if things look a little funky, you can have an answer within 2 minutes of knowing exactly what the pattern looks like, just to help with that uncertainty in diagnoses.
So primary diagnosis, not necessarily as a second line with a negative ambulatory pH study?
So that's kind of depends on kind of where we are. I think as far as distinction, yes, it might be unclear for, if we have a negative pH study, but then we're still really concerned for GERD, this can give us an answer. But, if we're already there, we're already doing the endoscope, we can put this cap on, go in, take a look, and have an answer for your patient when they're waking up from anesthesia.
How about use in patients with atypical GERD, patients with LPR or NERD, where the Bravo study is negative and then we're scratching our head and we say, what do we do next?
Yeah, and that's the biggest thing that we're looking at in foregut surgery and kind of just the treatment of GERD, is just knowing we're treating the right thing. And so what we see is those changes in the impedance, or basically it's kind of like a marker for how well basically electricity passes through the inside of the lining of the esophagus, and we see these different patterns. And so kind of what our outlook looks like here is kind of red means that there's less impedance to whatever the lining of the tissue looks like, whereas blue is closer to a normal impedance. And so based on kind of what things look like, so if it's all red, that's more consistent. And this is kind of how deep down the esophagus is. You can do this in a sequence of several quick measurements. If it's all red, that's more consistent with kind of an inflammatory process that's going on through the length of the esophagus, more consistent with EOE. Versus if you have red down closer to the GE junction, and then it transitions to blue being up top, well, that picture is more consistent with GERD. Now, they may ask, okay, how good is this test? How good is it telling? So the sensitivity and specificity of this test are about 96 and 99% of, or I might be getting that wrong, but very high, above 90% for both the specificity and sensitivity. Yeah, so specificity is 95%, and specificity is 95 as well. And positive predictive value is 96%. So pretty darn good test.
Yes, it is. Is there data on treatment of EOE and then MyView after the treatment? Is there any data on pre and post information? Not that we know of.
That's a great question. I don't know of any data.
Very
that
good.
doesn't mean it's not there, but we'll see. We'll have to check.
Okay. Thank you for the session.